Ohio will not rise to its highest level until we do even more than we already have in several very important areas. And I want to talk to you about those. Let's begin by talking about mental health. Now, I'm very proud of the work that we've started together. And we've done a lot in the area of mental health in the last 3 years. But despite our best efforts, it still is not enough. Mental illness remains on the rise in Ohio. Suicide is one of the top 10 causes of death for Ohioans aged 10 to 24, with the rate rising in rural Ohio and in communities of color. Accidental drug overdose deaths remain at record levels. The shared adversity of the COVID pandemic has worsened rates of depression, anxiety, addiction, and post-traumatic stress disorder. Access to care still remains elusive for far too many Ohioans. And over 40% of Ohio children have experienced one or more adverse childhood experiences, putting them at higher risk for lifelong health and mental health challenges. We can change this. While we can never fully remedy the mistakes of the past, we can resolve to change the course of history moving forward by making help visible, accessible, and effective in all communities of the state of Ohio. We can do this by investing significantly more resources in the following. 1, we must grow our behavioral health workforce. 2, by increasing research and innovation. 3, by building a community capacity for care that offers better crisis response services and treatment, increased prevention efforts, and more residential and outpatient services. The future Ohio that I envision has the best, most robust behavioral health workforce in the country. A workforce that is hailed as heroic and valued as a vital part of our whole healthcare system. I see in Ohio with expanded residential and community-based outpatient treatment options, so fewer of our fellow citizens need to be institutionalized or placed in long-term hospital care. I see an Ohio that catches and treats mental health problems and addiction at the earliest onset to lessen the chances of lifelong challenges. And I see an Ohio where families get support in their own communities as well as at school, so that teachers can teach kids, kids can learn, parents can worry less, because all kids in the classroom benefit when every child has the support to be physically and mentally healthy and the opportunity to live up to their God-given potential. I see an Ohio that harnesses the innovative potential of our great research colleges and universities to conduct strategic cutting-edge research. I see an Ohio with fewer emergency room visits and where fewer Ohioans with mental illness are living on the streets. I see an Ohio where mental illness isn't criminalized, lessening pressure on the criminal justice system. In the Ohio I see, fewer families face the unimaginable grief of losing a son, daughter, brother or sister, or a parent to suicide or to an overdose. I see an Ohio where shame, fear, stigma, and embarrassment are erased. I see an Ohio where mental illness is treated as a health issue, not as a crime. And those who seek health are met with respect and treated with the dignity that they deserve. Realizing this vision will require us to take a giant step forward. But if we build on our successes and the work we've started together, we can truly bring about lasting change.